Namaskaram. I am Dr. Shiva Shankar Dalai, Chief of Neurovascular Intervention at Medicover Hospital, Visakhapatnam. We will talk about spinal dural AV fistula. This is a rare, complex disease of the spinal cord, often underdiagnosed. So, for example, the patient will start with a back pain. A middle-aged man or a middle-aged woman suddenly start having back pain, which progressively increases. That happens to many of us, that you are having a back pain. It's not very rare. But what happens is slowly they get weakness over both of their legs, which progresses. So we call it as a progressive weakness of both lower limb, which is associated with the back pain. And then slowly, as the disease progresses, what you will see is that the patient will have a bladder and bowel dysfunction. So what this bladder and bowel dysfunction will happen is patient will complain of constipation. They will go to the Latin every 3-4 days, and the time duration increases. First, they will say that I'm going to the Latin once a day, then once in 2 days, once in 3 days. The constipation continue to increase. And in the bladder, they will not be able to empty their bladder. So they cannot empty their bladder. That's why they will go to the toilet very frequently. Every 1 hour, every half an hour, they will go to the toilet and they try to do the micturition, but they will not be able to do it. So these are the typical symptoms of spinal dural AV fistula. And the diagnosis is simple. Once anybody has these symptoms, the doctor will prescribe one MRI of the spine, which will tell us that there is a spinal dural AV fistula, because there can be flow voids, there can be cord edema. Those things will indicate us that the patient is having a spinal dural AV fistula. And how do we finally diagnose a spinal dural AV fistula? That is by a DSA angiogram. By doing a digital subtraction angiogram of the spinal system, we will be able to know that the patient is having a spinal dural AV fistula or not. Once we do a DSA, we are very sure that this is a spinal dural AV fistula. It can be treated by endovascular method. Without any cutting or stitching, we can put a small puncture in the groin and go into the area of the fistula, embolize that with liquid embolics like glue and lipidol combination. Now, why the spinal dural AV fistula comes? We do not know. Most of the time, it comes spontaneously, although it comes after birth. So it's an acquired vascular lesion of the spinal cord, but we do not know the exact cause. Some says that it is because of the trauma, or it can also happen because of a surgery on the spinal cord on the dura. Dura is basically the covering of the spinal cord. And on that, if there is a surgery on the spinal dura, there's a possibility of a spinal dural fistula. And as I said, trauma is another cause. So these are the two common proposed causes, but most of the time we do not have such history with the patient most of the time, and we say that it is symptomatic. It's just spontaneous disease that comes to anybody, most commonly in the middle-aged. Now, today we will see how to treat a spinal dural AV fistula. Let's go. This is basically an angiogram of the spinal cord. The angiogram of spinal cord means we basically inject the intercostal arteries and the subclavian artery and the internal iliac artery, the median sacral artery. These are the arteries we examine, and sometimes also we examine vertebral artery on both sides to complete a spinal angiogram. Here you can see the spinal angiogram, which is demonstrating a anterior spinal artery. So this is the anterior spinal artery, which is like a hairpin bend. You can see this anterior spinal artery, and this is going up, and this is the anterior spinal artery that you can note. It's a very, very important artery. If you embolize or close this artery, the patient will become paraplegic for life. It's irreversible damage. So it's very important for us to identify this anterior spinal artery. As we are doing the angiogram of this middle-aged man, we see that there is a spinal dural AV fistula which is coming from the right side intercostal artery at the level of D7. So we can see this angiogram demonstrating the fistula, because this is the arterial component, this is the fistulous component, and this is the venous component. So basically a fistula will have artery, vein, and in between the artery and vein where the normal capillary network should lie, instead of there's a little bit of nidus, or it's a fistula, and that's why we call it as a spinal arteriovenous fistula. And because it is over the dura, we call it as a spinal dural AV fistula. So we are planning to embolize this spinal dural AV fistula because this patient has presented to us with progressive weakness of both the lower limbs, severe back pain, and bladder and bowel symptom. As we look at the angiogram, we can very well see the spinal dural AV fistula with the arterial component, the fistula, and the venous component. And now we are trying to take our catheter inside that. So we have chosen a magic 1.5 here with a hybrid, and then subsequently the Chikai 008 wire. We are trying to go in there. That could be a little bit of challenge, but you have to continue to take that challenge. And now we can see very well that my catheter has gone inside the arterial component, and from the arterial component I am almost at the level of the capillary, and this amount of capillary and this venous. The embolization should be planned in such a way that you take a part of the vein, the fistula, and the artery to get a complete cure in such situation. We have prepared a 16% glue with a combination of lipidol. That's a 0.5 ml of glue NBCA plus 2.5 ml of lipidol. That makes a combination of 3 ml of dilute glue, which will be injected. Because looking at this angiogram, I decided that that amount of the dilution will be good for me, and that's where I started injecting under a roadmap guidance. You can see that under this roadmap guidance we are injecting the glue, and finally you can see the glue cast. This is the glue cast. There's part of the vein, the fistula, and the arterial component of the spinal dural AV fistula has been occluded beautifully. You can see the glue cast here, and this is the angiogram after the embolization of the spinal dural AV fistula completely. You can see that the fistula is no more filling, and instead of that the fistula is occupied by glue completely, and the fistula has been taken care of. And this is an angiogram which is showing absolutely cure of this fistula. And finally we wanted to check the ASA, which is looking very beautiful and feeling much nicer, and that is how we achieve complete cure of this spinal dural AV fistula. Thank you so much.